Okay, so a good question are that suppose we provide 100% FiO to the patient and we take a ABG sample of this patient. So what is the corresponding PO2 or PO2 we found in the ABG? If the lungs are normal, it is usually around 500 mm of Hg. So in the same patient, in which the ABG is showing 500 mmHg of the PO2 on the corresponding 100% FiO2, if we take the VBG of this patient, what could be the maximum PO2 in the VBG of this patient, so that this will help us to identify whether we have taken an ABG sample or the VBG sample. So understand that what happens. In the routine VBG sample, the PO2 is somewhere around 30 to 50 mm of Hg. Now, even if we provide 100% of FiO2, what will happen? What happens that in at the tissue level in the blood, the oxygen travels in the form of combined with the hemoglobin and in the plasma dissolved form, and it is the plasma dissolved oxygen which is getting diffused into the cells, and then on a concentration gradient, and this, when the dissolved oxygen is used, it extracts oxygen from the hemoglobin. So the normally the dissolved oxygen at 100% FiO2, if we consider in the PO2 in ABG is 500 mmHg, it will come around some 1.8 milligram per deciliter. The tissue extraction is somewhere around more than 5 ml per deciliter. So obviously the plasma dissolved oxygen will not be able to sufficient to provide it. So it will extract oxygen from the saturated hemoglobin. And as the saturation of hemoglobin will fall, the corresponding oxygen hemoglobin dissociation curve, you will see that around 80-85% of saturation at the tissue level, the PO2 will come around somewhere around 60 to 70. So the maximum PO2 which can be achieved in a patient in you whom you provide 100% FiO2 with the lungs normal can be somewhere around 80 mm of Hg. If it is coming more than that, accidentally it may happen that you have a punctured the arterial sample or it is contaminated somewhere like that. But it will usually not cross the PO2 more than 80 mm of Hg. So this is important and it will help us to differentiate between ABG and VBG sample at times. So everybody should do read more about it. Thank you.